Hot days, humid days, mosquito-filled days here in Georgia. You know the routine if you've been here for any period of time. But aside from the nuisance, Fulton County health officials have confirmed a mosquito has tested positive for West Nile virus in Atlanta, just as recent rainfall is creating some ideal breeding conditions. So want to have a chance to talk more about this, how you can protect yourself and the people around you. Orkin entomologist Ian Williams joining us now with a couple of simple steps to take care of this the best we can. We talked about it just being a nuisance, but it can also have some health implications. So we really appreciate the time here, Ian.
Yeah, Cheryl, thank you so much for having us on to talk about this important
Can you
topic
hear me
and talk
okay?
about public health.
I see you. I see you. We're getting your volume up. Can you hear me okay now?
I can. Can you hear me?
We love technology. Stick with me here, Ian. We're trying to get you set here. Again. All right, let's try it now, Ian.
Yeah, can you hear me okay?
This is reminding me of the pandemic days when we'd all find ourselves on mute. All right. Try me one more time, Ian.
Hey, Cheryl, can you hear me okay?
That must just be in my ear. All right. Everyone else says they hear you. So I'm going to start a question for you. How concerned should people be when we talk about the confirmation of a West Nile case?
So that's a great question. One of the things we want to be aware of is we don't want to be fear mongering, right? It's not something that people need to rush out and do anything crazy about, but it is important to understand when it comes to mosquitoes, they can vector a variety of diseases, and West Nile is certainly one that can impact humans. And so it's a good reminder the importance that mosquito control efforts and surveillance do to really help make sure that the public is safe from these pests. And so lots of different things that individuals can do to help manage mosquitoes and trying to keep themselves and their loved ones safe.
As an entomologist, what kind of trends do you see when there's one confirmation? Is that usually an indication of more cases to follow? Might this just be the beginning of what we need to keep an eye on closely?
Yeah, it's another great question. Some of the initial reports that have come out talk about this being pretty early in the season for this to show up. And when we see things like West Nile that are reservoired in other animals like birds, the indication is that it's here, it's in some of these reservoirs, and now is the time to be diligent and make sure that we're trying to keep these populations of mosquitoes under control and keeping ourselves individually protected as best we can when we're dealing with mosquitoes so that we don't have to deal with some of the larger implications of some of these vector-borne diseases.
We're in a pattern here of pop-up showers, throughout the day. Can you talk us through why these rainy times or rainy patterns have an impact on the number of mosquitoes you might see?
Yeah, that's a really great question. When it comes to mosquitoes, mosquitoes, while we see the adults flying around, the young are totally aquatic. So mosquitoes need standing water to be able to, lay their eggs and their eggs to hatch out. And those eggs and larvae and pupa will all live their lives up until the adult stage in water. And so when we get these really heavy, intense storms like we've been having lately, we get pockets of puddles or things that get filled with water that maybe hadn't been so much of a concern earlier in the year when it was much drier. But children's toys or landscaping features that are able to hold this standing water now become a really big threat as a mosquito breeding ground. And so opportunities to evaluate that or survey your property are super important to be able to eliminate that water and thus eliminate breeding sites for mosquitoes. And so it's a great way to kind of get ahead of some of the challenges with mosquito populations and the growth that can happen with those.
So everybody kind of check their property. Maybe it's an apartment building or your home, and those are the things that you need to keep an eye on. So in terms of prevention, does that tie into them? What can people do in terms of prevention to make sure that they can limit their risk of West Nile or just the inconvenience of just getting kind of eaten alive, as people like to say, in
Yeah.
terms of mosquito bites?
Yeah, so there's lots of different things, right? Source reduction of water is one of the biggest. There are various very specific products that are designed to be in water that are only toxic to mosquitoes. That some are available to the general public, others are more professional use. But having a professional come out and assess your home or property for some of these areas and provide targeted treatments for both what we call the larva or larviciding, and potential adulticide treatments, where you might imagine that as a backpack mist blower or something like that to put out products to try and kill these adult mosquitoes. So those all help to reduce the number of mosquitoes in general. And then as an individual, CDC and a lot of other great state resources have a lot of guidance on, making sure nobody likes to do it, but in the summer and hot months, wearing long sleeve shirts, long pants to protect your skin, and wearing EPA registered insect repellents. There's lots of really great data on those, working really, really well to keep mosquitoes away from us. And especially if you've got, young children or babies, things like that, using even mosquito netting to just physically stop them from being able to get to a baby in a stroller or something like that is a really great way, again, to help just stop the mosquito from getting there in the first place. So a multi-tiered approach, right? Reduce the population, reduce appearance of mosquitoes on your property, and then trying to keep them away from us as individuals is really the way to kind of think about it.
That's such a great tip about the mosquito netting on the little ones, because I know a lot of people concerned about chemicals with a little baby or a really young one.
Yeah.
So I love that's terrific advice. Before we let you go, the focus, of course, being West Nile, because we have that confirmation in Atlanta right now. But are there any other illnesses that people should be aware of when it comes to a connection with mosquitoes?
Yeah, I think we've had several in the last couple of years. We had some of the first cases of endemic malaria in the U.S. The last few years. And so, again, mosquitoes are a very competent vector for a variety of encephalitises, things like malaria, dog heartworm. And so all of these things play into, public health focus, keeping ourselves and our pets and our loved ones safe. And so it's just so important to understand that there's such a variety of diseases that they can transmit, focusing on those core principles of reducing the ability for the mosquitoes to breed in the first place, and then stopping them from letting them bite us is really what we want to focus on, because there's no real way to know, aside from like the great surveillance that we've seen showing this West Nile virus, that we don't know what each individual mosquito's got. And so the best case is prevention. How can we just stop it from happening in the first place, keeping ourselves safe? And that's really what we want to focus on.
Yeah, you never quite know what that mosquito that lands on you is going to bring to you. So really important to protect yourself. Orkin entomologist Ian Williams, we really appreciate the time and the expertise. Thank you so much.
Thank you.